My name is Christopher Kitchen. I work at Health Policy and Management as a research analyst.
Could you tell me a little bit about the Center for Population Health IT?
Sure. We are partially grant funded, partially supported through support of software that's published by the university. Much of what I do as far as support is provide analytical insights to that software and to our research aims. Those insights cover things like population stratification of risk and providing information for clinical decision support.
What do you do to support the mission of HPM?
As a research analyst, I provide analytical support for a lot of our researchers here, principal investigators, but I am also responsible for designing a lot of our studies and implementing a lot of code and developing a lot of code for reuse in the future.
What motivates you to come to work?
Much of what motivates me, I think, is related to people I've known over the years that have gotten sick or have struggled with substance use and mental health. I've always been in something that's kind of adjacent to mental health. Previously worked at NIDA, the National Institute on Drug Abuse. I've worked at Kennedy Krieger early in my career as well. So that's, for the most part, always what's been motivating me.
How have your career goals changed over time?
I originally got my bachelor's in science at University of Maryland, Baltimore County. It was in psychology, and I pretty much went directly into getting a master's of the arts in human services psychology from there. And I was taking a track in behavior analysis. So at the time I was working at the Kennedy Krieger Institute, pretty much hands-on learning with kids. The experience there was one where I wanted to stay research adjacent, so I sort of decided not to go for certification as a BCBA because I didn't know that, at the time I didn't really want to go into the clinical route forever. I wanted to stay close to research. So that's actually what motivated me later to go back to school and get, in my view, the statistics that I sort of forgot or didn't pay attention to in undergrad and really needed.
Can you give an overview of what your career path has looked like thus far?
Sure. I've gone back to school kind of late as an adult. I previously had finished coursework for a master's in human services psychology. When I was getting that degree, my thought was that I'd be a behavior analyst or continue my work with Kennedy Krieger. I've since left that position after getting my degree and started work at the National Institute on Drug Abuse. There I was basically overseeing people enrolling in an outpatient methadone study and buprenorphine services study. From there, I actually went back to school, finished an analytics degree and a master's of science there. I worked at the University of Maryland for a while as another research coordinator position. And now I'm here, and I'm extensively using my analytics background.
Nice. Is there a certain research interest that you're passionate about?
Yes. Within the area of mental health, I'm very interested in substance use disorders, but also suicide as a topic has been something that I've been very interested to work in. I've had limited opportunity to do that prior to coming to Johns Hopkins. So we were working on a lengthy R01 supported project that was specifically looking at predictive modeling and risk assessment for suicide using observational data, electronic health records, and the like.
What impact do you hope to have?
Hopefully, with kind of that connection of putting insights to the fingertips of clinicians, we're able to actually have a meaningful impact on rates of death, whether that be from mental health crises or sort of inadequate medication use for different conditions. Those outcomes are things that we've always been focused on in our work, and translating that into practice is kind of the sticking point, the thing that we're trying to get better with.
What is one project you're currently working on?
I'm currently working on a project that is looking at population level information. So using census data to basically map out where housing instability exists, food insecurity and the like. That is something that will be added into the software that we support as well, and that hopefully will be useful information for caregivers and health systems.
When you're not working, how do you like to decompress?
I do a couple of things. I mostly try to spend time with friends as much as possible, but we've all kind of moved all over the place, especially in recent years. So a lot of what I end up doing is playing games with them online. We play video games, but I'm also, I've always been an avid tabletop gaming person, so I actually serve another role as a dungeon master for my D&D friends. Many of them were friends since college, and we've reconnected over COVID, so that's been really neat.
That's awesome.
Yeah.
And what kind of video games do you like to play?
Strategy for the most part. I'm really big into fantasy settings, but when I'm not doing that, I'm doing Sudoku and puzzles and things like that.
What are some nuances you can share about the concept of artificial intelligence?
Yeah, so I think there's probably a couple of separate aspects that we can look at AI, but I think that there is a lot of hype that has to be separated from the reality, kind of first and foremost, in each of these areas. Especially where it concerns finance and like business analytics. I think that it gets conflated with pretty much AI is everything and nothing at the same time. But in the healthcare setting, large language models are useful as a tool for capturing and summarizing text. They might also be useful for identifying certain conditions or things that might get overlooked by a clinician, but they're in no way a replacement for kind of the human in the loop. Conversely, if we're talking about robotics, then the whole point is to kind of remove the human. So like it might be more applicable to call those implementations true AI. I don't like the term AI in general because I think it does lend itself to conflating all of these different things. In my universe, a statistical model is a statistical model, so a linear regression is AI to me because it might be the most useful thing to use in some situations.
Do you have any book recommendations?
Sure. It's kind of dry reading, but a book that I would recommend for people that are interested in machine learning and specifically in analytics in healthcare settings is Artificial Intelligence for Improved Patient Outcomes by Daniel Byrne. He basically lays out all the reasons for why using machine learning in a healthcare setting should be treated with some caution. It is the work that I do, but it's also something that we can't lose sight of. I think that there's a lot of hype that gets talked about where there's kind of an overlap between computer science, AI, machine learning, especially in the healthcare setting. There's a lot that can go wrong. So we can't give up sort of our RCT methodology and other things in favor of moving fast and breaking things. And it's an author I really like that makes those points.